Go. The next thing I want to show you is how to tape a shoulder. In the EDS population, the majority of shoulders sublux inferiorly. So they fall down out of the socket, meaning they have a positive sulcus sign, and then they either sublux anterior mostly or posterior. With Ellen, she's subluxed inferior and anterior. I would say around 85% of the population of EDS does this same subluxation. So how I'm going to tape it is I use Leukotape. I am going to place a piece of cover tape right in front of where the deltoid and the pec meet, and I'm going to bring it all the way in the back to the scapula. I am then going to put a second piece of tape on the acromion and bring it down about 1 finger's breadth below the deltoid tuberosity. I am then going to come up with my Leukotape, and I'm going to place my first piece to pull it back. Again, we never pull with the tape. I am going to stabilize the scapula with my hypothenar eminence. I am then going to grab the shoulder and I'm going to pull it back right in. I will take up any slack on the skin. Remember, EDS skin is pretty stretchy, so you want to take up any slack, and then I will lock it down. The second piece I will use, I will place it right on top where the deltoid tuberosity is. Again, I'm going to actually stabilize the acromion, and I'm going to pull this up into the socket. Again, take up the skin and lock it down. We're going to use 2 pieces because I find in the EDS population it's better to use 2 pieces. So again, we'll lock it, we'll stabilize the scapula, and we'll pull the shoulder back into place just like that. You may feel a little click, that's okay, and you will lock it in place. And again, we'll come down to the deltoid tuberosity, lock the acromion, bring the shoulder up into the socket, and back down. Now, for my shoulders that are pretty unstable, I do place a third piece. So I would say for the majority of my EDS patients, this taping job is sufficient. If they move the shoulder, it still feels a little unstable, I will give them a little bit of stability. I will place a piece of cover tape right in between the 2 pieces I just did. I will then place it right there on the cover tape. And then I will try to pull the shoulder back and back into the socket, just like that. Again, I'll do the same thing. Stabilize the scapula, pull the shoulder back, and lock it right in. Smooth it out. If the person is allergic to tape, they're usually allergic to the adhesive, so you can place some milk of magnesia on the shoulder first, let it dry to a powder. That way it'll give a barrier between the adhesive and the tape. If that still does not work, some of my patients take the tape opsite. We will place that on first, and then we'll tape the cover tape and the Leukotape over it. You can get the cover tape and the Leukotape at Amazon for a combo pack for $20. Thank you.